The medication is right, the dose is right, the timing might be the problem, and nobody told you that. If you've been watching your parent take medication faithfully every single day, no missed doses, and things still aren't going the way they should, I want you to stay right here, because what I'm about to share with you changed how I think about everything I manage for my mom. And it might be the missing piece that you've been looking for. Hi, I'm Octavia Barrett. I'm a board-certified patient advocate, a caregiver, and someone who has spent nearly 30 years learning how to navigate the healthcare system for the people that I love. I'm here to help you do the same and to make sure you don't get lost in the process. If you are new here, welcome. And if you've been here before, thank you for coming back. Be sure to subscribe and hit the bell so you don't miss what's coming. I post every week, and this is the kind of content that nobody else is teaching caregivers. So let's dig in. Here's what most of us assume. If the doctor prescribed the right medication and the pharmacy filled it correctly, the medication will work. And that's fair. That makes sense on the surface. But there is a layer of this that almost nobody talks about, and it has to do with something called medication timing. Specifically, how your parent's body absorbs that medication and what happens when that process doesn't go the way the label assumes it will. And when you're caring for someone with conditions like heart disease, diabetes, or something called gastroparesis, a condition where the stomach slows down the process, this becomes a really significant issue, one that can make it look like the medication stopped working, when what's actually happening is something much more specific, much more fixable, if you know what to look for. So first, understand where medications actually go to work and why timing matters. Most oral medications are not absorbed in the stomach. They have to travel to the small intestines first. Gastroparesis, the delayed stomach emptying, slows that journey down. Gastroparesis is very common in people with type 2 diabetes. So if your parent has diabetes, this is worth knowing. And what this means in real life, the medication might arrive late or never reach its peak at all, which results in the medication looks like it isn't working, when really it just hasn't been absorbed the way it was supposed to. I want to give you a real example of what this can look like, because I am not talking about this from a distance. My mom has heart disease and type 2 diabetes. In May, she had a major cardiac surgery, and now, as I'm making this video, she is in recovery, and things aren't going as smoothly as we expected. One of the things making her recovery harder is her diabetic gastroparesis. Her stomach doesn't empty the way it should, which means the medications she needs to heal and stabilize are not always absorbing the way the label assumes they will. Right now, our family is actively working through her medications, her timing, what she's eating, all together with her care team, trying to figure out what's actually getting in and what isn't. I'm making this video because I'm living with it, not because I figured it out already, but because I know how disorienting it is to watch someone you love take every medication exactly as prescribed and still struggle. And I want you to understand what might be happening underneath all of that so you can ask better questions than I knew in the beginning. That is exactly what I want to do for you today. The next thing, know which medications are most effective by delayed absorption. For example, furosemide. It's a Lasix, a diuretic most commonly used in heart failure. is especially vulnerable to this. If the stomach empties slowly, the diuretic absorbs slowly, which means swelling doesn't go down on schedule. Breathing may stay harder. Weight may go up. Another is mealtime insulin. Standard protocol is to take it before eating, but if your parent has gastroparesis, the food absorbs later than expected, and the insulin peaks before the glucose even shows up. Early low blood sugar, hypoglycemia, followed later by high blood sugar, that is a dangerous mismatch. The metformin extended release is supposed to be taken with the evening meal and should never be crushed, cut, or chewed. If someone with gastroparesis, it can also worsen nausea and bloating. The GLP-1 medications like semaglutide or tirzepatide, brand names include Ozempic, Wegovy, or Mounjaro. These medications actually slow the stomach emptying as a part of how they work. If your parent already has gastroparesis, that can make your symptoms worse and affect how other oral medications absorb. Here's what I want you to hear in all of that. This list is not something to be afraid of. This is a list of things to be aware of, so you can have smarter conversations with the medical team. Because the doctor sitting across from you does not always know what you're observing at home. They are not watching your mom take her diuretic at 8 a.m. and still swelling by noon. They are not seeing the blood sugar swings that happen 3 hours after dinner. They are not witnessing the nausea that seems to hit an hour after her afternoon medications. You are. And that observation is data, real clinical data. It just needs to be organized and handed to the right person. Before we go any further, I want to point you to something. I wrote a full breakdown of medication dosage forms, what they are, why they matter for someone with delayed stomach, and what caregivers need to know before the next appointment. It's on my website, and the link is right below this video. This is not general health information. This is the kind of specific, practical detail that actually helps you walk into that appointment more prepared than you walked out of the last one. Go grab it. The link is right below. All right. The next thing to look at is to start tracking. This is your most important job right now. A medication food symptom log does not have to be complicated. It can be a notebook or a note app on your phone or the back of an envelope. It doesn't matter what it looks like. What you're tracking is the time of medications were taken, what and how much your parents ate and when. Any symptoms that appeared like nausea, bloating, swelling, shortness of breath, dizziness, or confusion. If applicable, your blood sugar readings and what time they were taken. Weight, make sure you take that daily, the same time, every day, ideally in the morning. Was there any vomiting? Because if your parent vomits after taking a medication, that medication may not have been absorbed at all. Do this at least 2 weeks before the next appointment. Patterns will show up that you cannot see before. I know this sounds like one more thing on a list that is already too long, but here's what I want you to understand. This log is not just for the doctor. It is for you. When you start writing things down, you stop carrying it all in your head. You stop second guessing yourself at 2 a.m., wondering if the swelling was worse yesterday or the day before. You stop feeling like you can't explain what's happening because it's all blurring together. The log gives you something solid to hold and something solid to hand over. There is a reason I keep coming back to documentation. It is not busy work. It is the single most powerful tool a caregiver has when she walks into a room with a medical team. Next, know exactly what to bring to the pharmacist and why your pharmacist is your most underused resource. The pharmacist sees the complete medication picture. They can catch interactions and timing problems that may have slipped through. Ask the pharmacist specific questions like, which of these medications need to be taken with food or without food or separated from other medications? You may not be aware, but some medications interact with each other, so you may have to take them a certain amount of time apart from each other. So you may have to take one medicine 2 hours after you take another medication. The pharmacist can help you with that. Another question can be, are any of these extended release or enteric coated? Can they be crushed if swallowing becomes an issue? Or another question might be, given that my parent has gastroparesis, are there any formulations that might absorb more reliably? And note that extended release and enteric coated medications behave very differently in someone with gastroparesis. Your pharmacist can help explain this. There's also liquid formulations that sometimes absorb faster than tablets. Your pharmacist can help tell you if that is an option. And this conversation is free. And it may be that one of the most useful conversations you have this month. I think a lot of caregivers walk past the pharmacy counter without realizing what's standing behind it. Your pharmacist has a complete picture of every medication your parent is taking. They have the training in how those medications interact, how they're absorbed, and what variables affect them. And unlike a doctor's appointment, which is usually 15 minutes on a good day, a pharmacist conversation can actually breathe. You can say, I've noticed her diuretic doesn't seem to work lately until the afternoon. Does that make sense given what you know about her medications? And a good pharmacist will tell you something useful. So don't walk past that counter. Stop and have that conversation. I want to pause here and ask you something. Have you ever noticed a pattern, a medication that seemed to work differently depending on when it was taken or what your parent had eaten, and you didn't know what to do with that observation? Leave it in the comments, because here's the thing about medication timing. You might already be seeing the clues. You just need to know what to look for and what to do with them. And I want to hear what you've been carrying. Next, know what patterns to watch for in heart failure specifically. Sudden weight gain, more than 2 to 3 pounds in a day or 5 pounds in a week, is a red flag that fluid is building up. This may mean the diuretic isn't absorbing or working as expected. Increased swelling in legs, ankles, or feet, especially if it seems to be getting worse despite taking the medications consistently. Increasing shortness of breath, particularly when lying flat or doing minimal activity. Confusion or unusual fatigue. In an older adult with heart failure, this can be a sign of poor cardiac output affecting the brain. Frequent ER visits. If your parent keeps ending up in the emergency room despite taking medication as prescribed, the absorption question is worth raising with the cardiologist. My mom went to the ER nearly every month for years. Once I started paying attention, really paying attention to the patterns between what she was eating when she was taking her medications and what symptoms she was experiencing and what were getting worse, things started to shift. In 3 years of actively advocating for her, the ER visits dropped dramatically. And then May happened, major surgery. And we're back in the thick of it, watching for exactly these signs every single day, because the stakes right now are as high as they ever have been. I'm not telling you this because I have it figured out. I'm telling you because I want you to know that even someone who does this for a living, even someone who has been advocating for her mother for years, still has to watch out for these patterns, still has to track, still has to bring the observations to the care team and keep asking questions. This work doesn't end, but it does get clearer. And knowing what to watch for makes all the difference. Next, know what questions to bring to the doctor and how to frame them. Come with your log in hand. Be specific. I've noticed the diuretic doesn't seem to take effect until late afternoon. Here are the times and the symptoms. Showing specific observations gets specific results. Ask directly. Could delayed stomach emptying be affecting how her medications are absorbing? Ask about formulation options. Is there a liquid version of this medication? Is there a formulation that might absorb more predictably for someone with her condition? Ask about timing adjustments. Is there a better time of day to take this medication, given what we know about her digestion? Ask about mealtime insulin timing, if applicable. Like, given her stomach may be slow to empty, should we be adjusting when she takes her insulin relative to her meals? Be sure to write down the answers or bring someone to help you remember. One of the things I learned the hard way is that doctors respond to specificity. If you walk in and say the medication doesn't seem to be working, that's hard to act on. If you walk in and say, I've tracked this for 2 weeks and here's what I'm seeing. She takes the diuretic at 8 a.m. The swelling doesn't start to go down until after 3 p.m. And on 3 occasions in the past 2 weeks, she had significant shortness of breath before noon. That's a completely different conversation. The log makes you credible. The questions make you a partner, and partners get different information than passive family members waiting to be told what to do. You belong in that conversation. Make sure you're in it. Next, know when something needs to be escalated and don't wait. If your parent vomits frequently, the medication they just took, ask the prescriber what to do in that situation, whether to redose or wait for the next scheduled time. If symptoms are getting significantly worse, more swelling, more shortness of breath, rapid weight gain, don't wait for the next scheduled appointment. Call the care team. If blood sugar is swinging widely, very low before meals, very high hours after, that timing mismatch is worth a same week call to the prescriber, not a wait. Dehydration is a real risk with certain medications, especially the SGLT2 inhibitors and diuretics. Watch for signs like dark urine, dizziness, confusion, dry mouth, rapid heart rate. You are not overreacting by calling. You are doing your job. And I want to say something directly to the caregiver who is sitting on information right now, who has noticed something and talked herself out of calling because she doesn't want to be that person. You are the person who is paying attention. That is not a burden. That is the most important role in your parent's care. The medical team is not with your parent at 7 a.m. when she takes her medication. They are not there at noon when the swelling doesn't go down. They are not watching the blood sugar numbers at 6 p.m. You are. That observation is not nothing. It is everything. And the right medical team wants to hear it. Don't talk yourself out of that call. Now, here's what I want you to take from today. Medication timing is not a small detail. It is one of the most overlooked pieces of the medication puzzle. especially when your parent has a condition that affects how quickly their stomach moves things along. And the most powerful thing you can do right now is to start watching, start writing it down, and start bringing that information to the right people. I wrote a full breakdown of medication dosage forms, what they are, why they matter, and what caregivers need to know before the next appointment. The link is right below this video. Go read it. I will give you a foundation for everything we talked about today. If this video gave you something useful, I would love for you to hit the thumbs up. It helps other caregivers find this content. And if you know someone who is managing medications for an aging parent and things don't seem to be working quite right for them the way that they should, share this video with them. They need to know this. Subscribe if you haven't already, and come back next week. I'll be here. You are paying closer attention than you know. Keep going. Your parent is lucky to have you in their corner. And so is the medical team, even if they don't always say so.